The mirror keratoprosthesis is composed of an optical cylinder and a frame. It has the characteristics of not requiring a donor cornea, having a wide range of indications, and being able to treat patients with failed corneal transplantation. The surgery is divided into 2 stages. In the first stage surgery, the mirror keratoprosthesis frame is implanted. Incise the conjunctiva, expose the limbus of the cornea, and cauterize to stop bleeding. Perform a lamellar incision along the limbus of the cornea for about 6 mm. Separate the corneal stroma layer and form a corneal lamellar pocket, approximately 8.5 mm 6 mm. Implant the mirror keratoprosthesis frame into the middle of the corneal lamellar pocket and position it at the center of the cornea. Intermittently suture the limbal incision and the conjunctiva with 7-0 or 8-0 absorbable sutures. In the second stage surgery, the mirror keratoprosthesis optical cylinder is implanted. The second stage surgery is performed 3 months after the first stage surgery. Establish the PPF vitrectomy infusion and the vitrectomy incision. After confirming the center of the mirror keratoprosthesis frame, use the end of the corneal trephine to drill out the anterior layer tissue at the center of the mirror keratoprosthesis frame. Use the end of the ophthalmic fork to rotate counterclockwise to remove the embolus and clear the residual fibrous soft tissue. Then use the B end of the corneal trephine to remove the posterior layer tissue at the center of the mirror keratoprosthesis frame through the central hole of the cornea. Crush and remove the lens nucleus and cortex. Use the B end of the ophthalmic fork to vertically screw the selected optical cylinder into the center of this frame and tighten it to ensure there are no wrong buckles or looseness. To reduce the residual lens peripheral cortex, it is possible to use the PPF method. Use the vitrectomy head to clear the residual cortex and excise the peripheral iris and the anterior segment of the vitreous body. Use 7-0 or 8-0 absorbable sutures to suture the wound respectively, remove the infusion tube, and tighten the sutures.